How does lisinopril treat hypertension? Lisinopril lowers blood pressure by targeting the renin-angiotensin system. Specifically, it targets the conversion from angiotensin 1 to angiotensin 2, as angiotensin 2 is the main culprit for increasing blood pressure. Lisinopril falls under a drug class known as ACE inhibitors, and it does exactly what it sounds like it does. It inhibits ACE, the angiotensin converting enzyme. Uninhibited, angiotensin 1 fits into the active site of ACE, from which ACE modifies the angiotensin 1 to form angiotensin 2. Angiotensin 2 then promotes the increase of blood pressure with vasoconstriction and the production of aldosterone. Lisinopril disrupts this reaction with competitive inhibition. What this means is that lisinopril also fits into the same active site of ACE that angiotensin 1 fits into. By occupying the active site of ACE, angiotensin 2 is unable to fit into the enzyme, and thus is unable to get converted to angiotensin 2. By blocking the angiotensin 1 from ACE, this decreases the amount of available ACE in our bloodstream, and thus we limit the conversion of angiotensin 1 to angiotensin 2, decreasing the amount of angiotensin 2 in our bloodstream. The job of angiotensin 2 is literally to increase blood pressure, so we're very glad to be putting it out of business. By lowering the amount of angiotensin 2 in our bloodstream, we lower our blood pressure by reversing the two main mechanisms of angiotensin 2. With less angiotensin 2 to bind to tissue and muscle cell receptors, we then reduce the vasoconstriction, or the narrowing of our blood vessels. We also reduce the production of aldosterone. By reducing the production of aldosterone, we then allow our kidney to excrete sodium and water into the urine rather than reabsorbing it into our bloodstream. Thus, this decreases the volume of fluid in our blood vessels, thus decreasing our blood pressure.